When placing ECG stickers, it's important that the V1 goes in the fourth intercostal space on the right side of the chest. The best way to measure that is to feel for the sternal notch in the centre of the chest. It's usually around about here, which is just a little lump. You feel across to the second intercostal space, and then you count down to 3 and 4. And V1 needs to go in the fourth intercostal space as close to the sternum as you can. V2 needs to go in the same position on the opposite side of the chest. So again, you feel across to second intercostal space, 3 and 4, as close to the sternum as you can. We don't do V3 just yet, we do V4. V4 is in the mid-clavicular line, so centre of the clavicle down to the fifth intercostal space, which is just there. And it's usually in line with the nipple with male anatomy. Right. V3 then goes in the centre between V2 and V4. V5 is anterior axillar line, which is the crease of the armpit at the front of the armpit, down to the fifth intercostal space, just there. And V6 is mid-axillar line, so mid-armpit, again at the fifth intercostal space. There we go. And your limb leads, you want to try and put your limb leads as low down on the limbs as you can, depending on scar tissue. Again, avoid scar tissue because you won't be able to get a very good reading. The same goes for the chest. And the arms, again, low down if you can. However, if the patient has a tremor, it's better off higher up the arms.